Hi, it's Sunday morning. Alan and Andy here talking about return to healing. And there's so many things we could talk about, Alan. We've been chatting about things like, which maybe we'll talk about next time, how we in primary care get the brunt of everything. For instance, it's called value-based care, and if cardiologists do a bunch of stents on our patients, we're the ones who pay the price. It's
No,
kind of insane. But today we're going to talk about our favorite organization in America because they sponsor more television than any other group. It's actually a competition, Alan, between them and the food industry. But we already talked about drug ads, but we're going to talk about the industry itself
no,
and how much the pharmaceutical industry has literally penetrated every tentacle of um, of the medical industrial complex. And when we wrote our book, it became clear that this had already started by early 1900s. And in fact, the AMA, which is the group that pretty much drove the whole process of the industrialization of medicine, was in cahoots with the drug companies from even the late 1800s. And it became their main source of revenue. And it's interesting how most journals, even now, that we consider reputable, New England Journal, JAMA, are financed more by drug company ads than by subscriptions.
absolutely. Good morning, everyone. And, I'm agreeing with Andy as usual. Like, this is such a thorn in my side, and we talk a lot in the book about the industrial medical complex. For anyone who's joining us for the first time, it's big pharma, it's the device makers, the big hospital systems, insurance companies, and unfortunately, many of both the medical colleges, like the American Academy of Family Physicians and geriatrics and things like that, and the societies for the patients, like the Alzheimer's Association and the Diabetes Association. That's who runs medicine, uh, not doctors, not even really Congress. Congress has like the final say, but in addition to the most TV ads, Big Pharma is also by far and away the biggest lobbyist in Washington. So they can't change things as the way it is. And people say, well, why would we never have a national healthcare system? It'd be so simple, one person to send a bill to. Well, because that won't make the lobby money go to from the insurance companies anymore, because we won't need insurance companies the way it is currently organized, because we'd have one system and make it easy for everyone. And why should that be in our country?
And yeah, and obviously the pegs of the medical industrial complex, which includes specialty medical societies and big pharma, they're both pretty equal in terms of their lobbying power. It's interesting. We talk about like the American College of Cardiology as a the suit against the complaint against me is I don't follow their guidelines. Well, they're a professional society. They lobby Congress to make sure cardiologists get paid a lot of money and don't get punished for doing too many things. We get punished for it, but the pharmaceuticals are right there too. And a lot of the Congress people talk about, oh, we need to get a more stable. We have to have a drug plan. We have to do what Europe does and have restrictions on how much we're paying. But you notice they never do it. It's all talk. They're getting tons of money. Even our last president, Joe Biden, who I like the guy, um, he's one of the highest uh, takers of drug company money. And when he did I forget what it was called, like moonshot to cancer.
Yeah, that's
It was basically a gift to the drug companies. Everyone said, "Oh, wow, he's going to let us use drugs that haven't even been approved for cancer." Well, yeah, they don't want the drugs to be approved because you live 2 days longer on a lot of these drugs. And so he made this moonshot to cancer, but it was just basically so these companies could sell their sometimes, Alan, $50,000 a shot drugs and not have to determine if they actually work or not.
right. So the crux of this started because actually my wife sent me a little cartoon from the pharmaceutical industry. That's Andy told me is one of his sayings. So, big pharma, a patient cured is a customer lost. And, that's the truth. Because if we cure you, we don't need their drugs. And nothing, almost nothing in medicine that's developed is meant to cure you. It's meant to treat you and keep treating you, and then add another drug to treat you or another procedure to treat you. And we see that time and time again. And there's a lot of theory out there. If you look like with cancer treatment, for example, if you look at the history of cancer treatment in children, we have done an amazing job over the years, eliminating survival rates of almost 80% in most childhood cancers. And in adults, it's nothing like that. So the conspiracy theory out there, and this is true, a conspiracy theory. You could go on the internet and look. My wife sends me some of this stuff as well. Is you look out there and like they felt bad for the kids, so they decided let's cure their cancers and let's do a good job. And in adults, we can't do that because we're screwed because we're not going to make any money if we cure the adult cancers. So we invest essentially nothing, very little amount of money in trying to do early detection when it's appropriate. And we do everything to treat unnecessary cancers. So we have all these drugs for cancers that won't kill you. And that's a big business. We could talk about it from the dermatologic end, removing all kinds of crap from people that will never harm them. We could talk about it in every realm, but there is some validity to this because there's no cancer curing drugs out there. There's no Parkinson's curing drugs out there. There's nothing for any kind of complex illness. It's all treatment modalities. It's interesting. We got this new technique in the hospital that potentially, if it's a renal artery problem, they could potentially cure hypertension by doing some invasive procedures. Uh, and we know it could be the case if we look at what is the true underlying causes and fix the mechanisms in some of this stuff. But that would be no good for big pharma at all. Can you imagine if we didn't have hypertension and obesity and diabetes, what would they do?
You have to be sick. It is true, and I think that's why we don't have any nutrition training in medical school, nor is there any emphasis on putting money into nutrition. We put 50 billion into the GLP-1s every year, but we don't put anything in nutrition. Insurance just doesn't pay for that, and that's part of the whole policy. And not only that, are the guidelines, which we've talked about a lot, the new cholesterol guidelines, the new blood pressure guidelines, are all about making you feel sick. If you have a LDL cholesterol of 80, you have to go on drugs. If you have a blood pressure of 130, you have to go on drugs. The guidelines are designed to put you on drugs, and the groups that design these guidelines, in these cases, the American Heart Association, are basically conduits for pharmaceutical money. When we were researching for the book, I read so many things, Alan, that said that although the drug ads are good, they're expensive. Bribing congressmen and women, that's good but expensive, they said. But their biggest bang for the buck is sponsoring groups like the American Diabetes Association, and the American Heart Association and Alzheimer's Association and the CDC. All of them receive such copious drug company money, and they seem to be authoritative. In fact, I know a doctor who got in trouble because they didn't follow American Diabetes Association guidelines. Well, those guidelines are designed to sell drugs. There's no doubt. There's so many articles written about this from investigative reporters that somehow don't make it on CNN, but which also receives tremendous. And that's the other
Right.
thing, Alan. These media outlets are basically surviving because they receive drug company
A-
ads
a-
also.
Absolutely. One hand washes the other. And we know that the guidelines are made by the experts. Okay. Who are the experts? Not the people writing articles that say don't do this or don't do that. It's the people that work for the pharmaceutical companies. That's how they get famous. And that's how they get picked to be on expert panels. And guidelines are not necessarily evidence-based. They'll pick the articles they want to use that end up giving more drugs because that's what the pharmaceutical companies have. When the pharmaceutical companies come up with a study that's not positive for them, that study gets buried somewhere and never goes to get published. The only thing that gets published is something that shows their drug is great, period.
And there's something called a meta-analysis. And a lot of times when a big thing shows up on the New York Times, they say a meta-analysis proved that this drug works. Meta-analysis is a compilation of a bunch of studies. Well, A lot of the studies are junk, what are, we call observational studies that the pharmaceutical companies like because it shows correlation, i.e., we've talked about this before. People who drive Subarus have fewer heart attacks than people who drive Ford F-150s. Therefore, driving a Subaru reduces your heart attack. They could link anything to whatever they want. Oh, people who take this drug, have less this, and this. But also, it does, these meta-analyses do not include the studies that were buried, that were never published. And in fact, I got in trouble for saying this too, but Tamiflu, which we use for influenza, and in fact, the CDC not only recommends it but insists on it, as do public health departments in long-term care. But Tamiflu was based on a CDC panel uh, of people who are dealing with viruses, and when they looked at this panel, everyone on the panel had been an executive or a high level person in the drug companies that make Tamiflu, still with stock options. And the money that was used to fund this panel was all from that company too.
Yeah,
And the Cochrane analysis, which is a great group out of in Europe that doesn't accept any drug company money, and because Europe is not like us, they are, most European countries have to watch how much they spend because they do have single payer systems. They said, no, we want to look at the unpublished studies. So Cochrane got their hands on the unpublished studies, which showed that this drug does not work. And not only doesn't it work, it harms older people. Uh, and they said to the CDC, "Do you want to see this data?" And the CDC said, "No, we don't. We're good with what we have." And that level of complicity and deception goes across the entire industry. And yet people look at the CDC as this beacon of truth, where in fact most people who are running that organization have strong ties to
and
drug companies. And we could talk about the FDA, which is even worse.
yeah, and it's funny. Like when I talk to the residents about this stuff, whether it's Paxlovid, for COVID, if it's Tamiflu for the flu, or any of these things, it's you talk to them, and when they're in, I have the residents rotate one-on-one with me in my faculty practice, and we get a case of the flu, and they're like, "Oh, so we're going to start them on Tamiflu," and I was like, "Why?" Like, and like it's urban legend to them. Like, you have the flu, you get Tamiflu. You have COVID, you get Paxlovid. They don't look at any of the negatives and anything there. And I think even in the one positive study for Tamiflu that I think got it approved, I think it said it made you better in, like, you
Couple
saved
hours.
like a couple of hours of
Yes.
time, and that was significant, statistically significant. Like, I got better 3 hours earlier, but how many people did it kill? And what was the side effects? And what was the cost? Okay. And even the evidence, they use it all the time with that and in prevention. Does your nursing home still put
Oh,
everyone
they
on?
didn't say they have to. It's required.
Yeah,
And
so
it's
if somebody in the nursing home gets Tamiflu, everybody in the it gets flu, everybody in the nursing home gets Tamiflu. So bing ding bing. It's like
Yeah, this is how you sell drugs, and you create these protocols. So there's a great book which we've talked about called No More Tears, by a New York Times journalist. I think his last name's Gardner. Maybe that's his first name, Gardner Harris, I think. But he talks about just one company, Johnson and Johnson. And if anyone wants to really read about the drug industry in its fullest, I mean, we've heard about the people who make OxyContin and they're the bad people. Every single drug company plays by the same rules, which are no
absolutely.
rules at all. And this book really points. You can see the guy getting more and more angry as he's writing because he as a healthcare journalist has been duped so many times, he says. He said he fell for all this. And he
Yeah.
basically was an instrument of advertising drug companies in his objective articles. But he said, which we know, the FDA drug approval process is 100% paid for by the drug companies. And members of drug companies sit on the board that approve the drugs. This is how this dementia drug got approved, even after it failed
Yeah.
the first time. But also, what he says, which Alan and I have talked about a lot, is not the two places the drug companies say, and this is in our book, and we have it documented, just so you know. The two places the drug companies say are the biggest bang for the buck are these patient-oriented organizations that we talked about, like American Diabetes Association,
Absolutely.
and specialist doctors. And they said, we don't even have to, all we have to do is tell the doctors there's a new guideline or this drug
Yep.
works, and it could be just right off the shelf, hardly any studies, and the doctors are going to do it. And it's sad that the doctors of all people, my friend and I were listening to a George Carlin joke yesterday, routine yesterday, and you guys might not be old enough to know George Carlin who are listening, but he was just talking about how how doctors do this. The other great guy, this physicist Richard Feynman, who was part of the Manhattan Project, he writes all the time about doctors, and he says these are basically people who go to medical school to memorize things and become drones, non-thinking drones, so they could do the work of industry.
Yeah.
And
And
it shouldn't be that way, but it seems to
so
be more and
it's
more.
it's amazing. Like I've really studied the OxyContin thing. It's a great example. Another great example, if people haven't heard of the drug Vioxx, which was like a cousin of Celebrex that came out, which very quickly was shown to be really dangerous and was approved. Uh, but if you go back to OxyContin for a minute, I personally know one of the people who was at the center of the scandal who was, I'm not going to use names because uh, who was literally one of the fathers of pain management as well as hospice and palliative care. And I got to work with him in various palliative agencies. And when the whole thing came out, all of a sudden everyone started denying, but there was such a track of evidence, and it's not over yet. It's not over. I just read this week that the marketing company that did the marketing for OxyContin, they're going after them now and looking at some of the ads that they literally showed them how to deceive the public, and they would teach the reps how to deceive the doctors. And one of the things with OxyContin that they did was they went to primary care doctors as well, like not just the complex pain people. They went to primary care docs and says, OxyContin, which is Percocet for the people who know, oxycodone, it's long acting, and they sold it that this drug is safer and potentially not addicting. It is the same drug as Percocet. It's just long acting and in many cases a lot more potent. It was a lot more addicting. You didn't need a study to show you that. That was common sense. And it took like 10 years and multiple deaths or multiple hundreds of thousands of deaths to show common sense is not important when it comes to the profits over the patients in pharmaceutical companies and our mega industrial complex, which is continues to feed Congress.
And that too, there've been movies about that. There's a great book about it. And now I'm forgetting the name.
Yeah.
I guess I'm old, but
Me
again,
and Andy both have COVID brain, so
we have COVID brains. I never had COVID, so there you go. It just it's living through it. The the books again talked about the marketing technique of this company, and this company is from the Sacklers. Arthur Sackler, who's we talk about in our book. It was the father of this whole idea of fooling people. He marketed Valium as the housewife drug, and that's how he got it to sell. Get your housewife will be stop complaining if she just goes on Valium, and it became the top selling drug. But again, the Sacklers said we have a big sale industry, but our main sales industry are the doctors because they'll do whatever we tell them. We give them a line, they're not going to question it, they're not going to say why, they're not going to dig into studies, they're just going to do what we say. Another book that just basically threw the doctors under the bus for doing this. And I always say, as much as Alan, as much as I hate the drug companies, they don't write any prescriptions. And so I ultimately, it's our job, Alan, to be the barrier between them and our patients. We can't be the conduit through which they hurt people. We're the ones who are supposed to protect our patients. And I don't get it why the doctors aren't pushing back more.
so
I don't get it.
I get it. I have a little bit different perspective than you, Andy, being embedded in a residency. Number one, from years back, it was clear what happened. From years back, doctors are busy. family doctors would see such a high volume of patients to make a living, even in the 90s, a long time ago. Okay, before the gatekeepers and all of that in healthcare. And they'd have to see like 50 patients a day to make a living. And when you're seeing 50 patients, even if you're quick, you don't have a lot of time to read what's out there. And people were conned into that the drug reps are good people and they're there not to sell you drugs, they're there to educate you. And people bought into it. And it's easy to buy into it when they're giving you, a coffee mug and a pen and a nice dinner or a golf outing or a trip. I mean, they spent hundreds of millions of dollars wining and dining people. And early in my career, I must admit, I bought into some of it for a while. And I went to drug company dinners and listened and, said, oh, okay, this sounds good. And then I became a speaker for a while for some of these drug company dinners. And I went and I made some money. And when I look back, it's like, essentially prostituting yourself because they sold it to me and I sold it to other people at the time. I quickly found out that it was young people don't see that it's total BS. And what are they reading? They got their phones out. They're reading the guidelines that are made by the pharmaceutical companies as disguised drug ads, and they don't see it. They see like the Gold Society for COPD and the Diabetes Society as upward, wonderful organizations that would never mess with right and wrong or profits over patients. They truly believe that, and they go on their phone and say, oh, this person comes in with that. I need to start them today on an antihypertensive. I need to start them on a statin. I need to start them on metformin and a GLP and this. And people walk out of the office with 5 prescriptions. I said, I would never start more than one prescription on a patient at a time unless they're dying, because how the heck do you know what side effect it's coming from? Because any drug could cause anything. And they don't get the common sense of medicine because they're just pushed through the system. They don't think. They just read like their godly journal is up to date. Up to date is a proprietary handheld little app that you put in a problem and it gives you the answer. And it's also made by the experts who are paid to write up to date, period.
And yeah, pretty much every little medical app you could find has drug ads on it, which is interesting. But yeah, I mean, that's a big point, Alan, is that the experts in my area, they're mostly from Hopkins because I'm in Baltimore.
Mm-hmm.
They are doing research for drug companies. Every one of them is. Every expert is and you could look, Alan. You gave me a site to look at on ProPublica. You could, and we should probably put that. We'll link
We should
that.
do a public thing. We should
We
do
should,
something like
yeah,
that.
yeah, Alan and I will be zero because I don't even
No,
let.
no, I'm not. I'm
Uh,
I'm I'm $7.
oh,
Seriously. I'm
seven.
$7 on ProPublica.
Oh
So
man.
so we linked it back one day and I was asking the staff like around the time we saw it, did anybody take anything? And they said, well, one day someone was in from one of the companies and they left a box of munchkins to try and get in to see me. And, when I said I wouldn't see him, they left the munchkins and said, hey, take it for him.
Then they attributed it to you, huh?
Exactly.
And Munchkins, which makes the point that they do also try to poison you with food. But um, th- here's the trick, though, Alan, that I learned. This guy from Hopkins who wrote the new cholesterol guidelines, he doesn't get money from drug companies. The drug companies pay for all his studies. They pay Hopkins. Hopkins pays him. Therefore, he won't be on that list. And he could plausibly deny that he receives
Yeah,
drug company
yeah,
money.
none of the studies are on the list. The
Right.
list is purely, speaking engagements and handouts and things like that. It has nothing to do with the studies, and the studies are trillions of dollars.
And this is the drug companies are smarter than we are,
Oh yeah.
and they know how to evade every possible detection. And that's why their tentacles are so wide, why they hit so many different areas. So it looks like, I had someone yelling at me about my views on something. I don't know. This is every day, but they said, well, the doctors on CNN agreed, and this guy from Hopkins agreed, and there's an article in the New York Times agreed, and this Senator Sanders agreed, and you're the only one who disagrees. And I'm like, yeah, the drug companies have spread their
Yeah, it's
tentacles that wide.
their tentacles are everywhere. They are in our government through Congress, they're in our government through the FDA and the CDC, and they're in the diabetes associations and the cardiology associations and every association, and they come to hospitals and market their stuff there. And I'm not as much sure as in the insurance companies, but yeah, they negotiate with the insurance companies too, because we know that healthcare executives, the CEOs of these insurance companies, they could only take a certain percentage of the income that comes in there. So the higher the premiums and the more they spend, the more their executives make as well.
Yeah, that which is something else we should talk about. The fact that the executive pay is based on how much these insurance companies actually pay. They'll actually look for expensive stuff, but will not want to spend any money on the cheap stuff, which is you and I, Alan. That
Right,
because
because
we
again,
stop it.
there's no money in primary care. We've talked about this a lot. There's really been, we talked about early the major advances in healthcare, which had nothing to do with healthcare, like water and sanitation and things like that, we know. And maybe the first antibiotics developed saved a lot of people, but it was all about sanitation and water, which changed our lives and longevity. But it's the same thing that would change our lives now that no one wants to talk about. The only intervention in population health that's really been shown to be effective since that era is primary care, the things that me and Andy do. And the interventions in primary care that have shown by far and away to be the most effective is lifestyle medicine. We know for a fact, and this has been well studied, that what physicians do, what healthcare providers do, only affects 10, maybe at most 20% of someone's longevity. It's your genetics. It's what you do with those genetics. It's eating healthy. It's exercising. It's wearing a bicycle helmet and driving a Subaru and not a pickup truck. Like, we know all that because, so Andy's right. For the people who don't understand that analogy, people who drive pickup trucks smoke more and drink more alcohol. That's just a fact. And people who drive Subarus are safer people. Therefore, they're going to live longer. That is a fact. So it must be the Subaru.
You drive the Subaru, you smoke in a Subaru, you're still protected, right? That's exactly right. But that's correlation studies. Yeah, and a primary care based system actually costs much less and has better efficacy, but less drugs prescribed, less procedures done. So nobody wants a primary care based system who is making money on the fact that we are medicalizing everything. So we could talk about solutions maybe next time. The biggest solution though, Alan, is get them the heck out of every place they are. They have to get off the TVs. They have to stop they cannot have any contribution to research anymore. They have to be out of the FDA and the CDC. And they can't go to doctors' offices or give ads to academic journals because how could you possibly? It'd be like
Well, the
the
only ads in academic journals is from Pharma,
right.
and there's this one AI thing I use a little bit called open evidence. I've talked about this with Andy. He doesn't like it that much, but it's very good for a simple question. Like, I wanted to see the other day, I had a new patient with H. pylori infection, and the H. pylori treatment, controversial as well, is really nasty. You got to take like four drugs 4 times a day for 2 weeks, and everybody gets sick from it, and very few people could finish the course. So I hadn't read about it in a while, so I was quick. It was at point of care, and I said, "Any updates on the treatment of H. pylori?" And it was the same crap, 18 drugs a day, literally for 2 weeks, and lots of sickness and lots of diarrhea. But to get to that, I had to bypass an ad. So even on something like that, it's total ads.
Yep, and that's honestly what we have to get rid of. It's very simple to do,
Even the
unfortunately.
even the apps that advertise to physicians, like educational stuff they call like Medscape and all of these things and Kevin MD, all these things, you go in there, there's ads on every single frickin' thing.
Even when you go to conferences, they
Yeah.
they remind you to go to the industry, go visit the industry booths, which are all drug companies.
Because they're keeping the cost of these conferences down.
Which they do. Yeah, and they keep the cost of things down for convenience. That's by the way a tiny part of their budget. And it's so easy for them to do. And all the doctors, oh, thank you, thank you, thank you. So that's the solution is pretty easy, but when Congress is bribed and when so many people are making money from all this, it's really difficult. And at this point, the public seems to be well deceived about what's actually going on. So it's very
Well,
difficult.
yeah, I mean, the answer to the biggest part of the pharmaceutical problem, well, there's not one answer because, like we said, they're in every. We need to separate them from government. We need to separate them from hospital systems. They should not be allowed to have marketing representatives. It makes no sense. You shouldn't market to physicians. Okay. They should be able to have maybe educational specialists or something that could bring doctors the articles that were published to get the data out. So maybe they would read it or something like that. Samples in office are just a no-no, okay? They're just a no-no. It entices a doctor to start something, whether they think they're biased or not, okay? So if the GLP's out there, if the Ozempic rep comes to your office and brings you Ozempic every week, and the Zepbound rep comes to your office and doesn't give you samples every week, what one are you going to prescribe more? Even though you know Zepbound is a more potent drug, you're going to prescribe the Ozempic because they're coming to visit you every week and they're leaving you samples to start your patients. So it should be totally removed. There should be no drug reps and doctors. I have none in my office. So.
Yeah, I have none in my office either, and yeah, that's very rare. The specialists in my town, a lot of them have a lot. It's ironic, but
Well, we
yeah,
all need
so
lunch, you know?
they need lunch, and we bring a sandwich from home, but that's primary care for you.
Yeah.
That's all we got. Okay, Alan. Well, you have a good rest of the
You
Sunday
too, Andy. We'll see you next week, everybody. Don't forget to return to healing. Everything we're talking about is in the book.
and document it.
Yeah.